months, KXAN has traveled across Texas and the country to highlight mental health solutions surrounding school safety. A new program on the West Coast caught the attention of investigator Erin Cargile. Erin, something really innovative is happening in preschools there.
It is. In California, they have been adding mental health consultants to campuses to help teachers. I wanted to see it in action, so I traveled to the town of Concord, just outside of San Francisco, where some big changes have happened thanks to lawmakers stepping in. They were appalled at the number of preschool students being expelled in the state, so they passed legislation to end that practice, which in turn led to this new way of helping teachers dealing with challenging students.
Hey, good morning. Hi, how are you?
It's outdoor playtime at a state preschool east of San Francisco. 1 minute, everything is going smoothly. The next minute, things take a turn.
What happened?
Teaching assistant Luis Gonzalez is faced with another challenging situation.
Ms. Raya, I'm taking him inside.
He's bad boy.
It all plays out while Tina Sloan, a mental health consultant, is nearby,
Be careful, thank you.
watching another interaction between an associate teacher and students.
Oh, I see that big smile.
She's here at Cadango's Baldwin Park campus once a week, closely observing and sometimes adding input in the moment.
He really wants to see you to see what he's doing.
Teacher Luis.
But the real work happens later in the day when she sits down with staff like Luis, one-on-one, to unpack what happened.
I didn't really want to confront the child that did the biting, so maybe guidance on how to deal with something like that.
Can you tell me a little bit more about the hesitancy that you had to approach the child that bit?
Luis, a former landscaper, has only been here 8 months, but even Roya Sultani, who's been teaching more than 15 years, is thankful for the extra support.
We willing to learn. We happy for this program to come and show us how to meet the child's needs.
Recently, while Tina was here, a child refused to go inside after playing outside.
And he is screaming, not telling me, and screaming, and Miss Tina came close to me, very quietly came. I said, can you ask him what he's feeling?
The suggestion calmed him down.
He did so good, and he was happy. I was happy, the child was happy.
And it felt good.
It felt good.
You are so proud of what you just created.
Tina is a licensed therapist and now oversees Cadango's mental health consultants. The pilot program launched about a year ago.
I believe that in order to develop socially, emotionally well children, you have to have strong, confident adults that feel prepared and equipped to meet the different needs.
Let's work together.
She highlights their strengths and brainstorms ways they can better support students, which includes bringing parents into the conversation.
I wasn't sure what to expect.
Center Director Manuva Segi says prior to a consultant working with teachers, they had therapists who had worked directly with children. Tina says that's the big difference.
There is nothing that I can do once a week for 30 minutes with a child that's going to have the same impact that they can have because they are with those children every day.
Do you see it making a difference?
It's very new. It's about a year, but I have seen some changes in the relationship between teachers, stronger relationship. There is collaboration, bringing the team together.
How many books is he reading? A lot.
I have seen some changes in children, and some of the challenging behavior may not go right away, may not disappear, but depends on children's situations.
Cadango supported the mental health consultant bill that passed last year. It was written by a state lawmaker who was once a kindergarten teacher herself.
A lot of these issues, the mental health issues, I had no idea how to deal with them.
California state lawmaker Blanca Rubio says ending expulsion and adding consultants to a classroom rather than pulling the troubled children out got some parents fired up.
I'm thinking, it's all good, but you should have seen how many posts of people just really not happy with what we did. They said, well, oh yeah, leave those kids in there to ruin my kids' education. I mean, it was really nasty comments on our social media because of this. And I thought, it's a no-brainer, you're helping children.
Her goal is to eventually expand it to K-12 classrooms. She's still waiting for the data on how many children and teachers have been helped through the program and how many are showing signs of success. It's data we're waiting on too. Cadango's end goal is to have mental health consultants helping the teaching staff at all 50 of its preschools.
Give me 5.
It's not always the best paid work, not always the best appreciated work, and it's certainly hard work, but it's valuable. They are helping to lay the foundation.
Erin, what's been the biggest challenge of the program?
So Cadango, which currently has the program on 15 of its campuses, says it is sometimes tough to find the time to pull those teachers out for the one-on-ones and group meetings. So they have other staff members fill in the gap during that classroom time.
What about the money?
It is a big investment by the state each year. So any center that has a mental health consultant gets 5% more per child in state funding.
Do other states have anything like this?
We checked and we found at least 20 to some degree. About half of those are statewide programs. Texas is not one of them, but every federally funded Head Start center across the country is required to use a mental health consultant, though the range of services offered varies.
All right, Erin, thank you.
Online now, explore our digital project, Save Our Students, Solutions for Wellness and Safety. See why we're taking a closer look at this important topic. Stories from across the nation, in-depth conversations with school workers on the front line, interactive analysis of what's happening with mental health and your children, plus community outreach and resources to get help for your family. It's all online now at SaveOurStudentsTX.com.